The Missouri Nurses Association announced last month they stand with employers that are requiring all their nurses and healthcare workers to be vaccinated. Joining us is Heidi Lucas. She's the state director for Missouri Nurses Association. Heidi, you've said the association did not come to this stance lightly. Can you explain?
Yeah, so getting the vaccine is a very controversial issue, right? Nobody really likes the government or their employer telling them what to do. And we totally understand that. We get that folks are hesitant, particularly since the vaccine is so new. And there have been histories of that folks are taught during nursing school about how vaccines are created. And typically they do take a long time to create and come forward. We understand that. However, we have very much looked into the process of how this vaccine was developed, the research that went into it, and the effectiveness level of it. And right now, with the information that we are given and that we have, the vaccine is highly effective at preventing major disease in regards to COVID-19. So we as an association believe, in our board of directors, we had long discussions about this, whether or not we were going to support the organizations that have come out and said that they're going to require all of their staff to be vaccinated. And I think with all of the information that was available to us, it is in the best interest of the nursing profession, as well as practicing nurses and the public in general, to have healthcare workers get the vaccines to stop the spread, as well as to help prevent serious illness. Our poor nurses are overworked. We are getting to a crisis level in our hospitals right now. And a lot of nurses have stepped up and done their ethical duty and gotten vaccinated. And we think it's important that the rest of the nurses follow suit.
Well, before we go tonight, I want to ask you, we live in an area where, as of Monday, about 21% of our population is fully vaccinated. What would you tell folks at home tonight who are resistant?
I would tell them to ask our nurses, the ones who are working in the front lines, the ones who are working in our emergency departments and our COVID units and our ICUs, what COVID actually does and how bad it really is. Honestly, when folks see the stuff up close, our nurses who are working the front lines, they were first in line to get vaccinated because they know how bad COVID is. And nobody's immune to it, right? Nobody is immune to the effects of the COVID-19 pandemic. Whether you have friends or relatives, somebody you know most likely has had it. And unfortunately, we're seeing a lot more folks who know somebody who has passed away because of it. And I think for us to get back to a normal life, the life as we used to know it, the vaccine is the best way forward at this point. So it is important to do that. We're also seeing a lot of burnout from our nurses, from folks who are upset and hurt that, and they're seeing patients who are begging for the vaccine as they're about ready to be put onto a ventilator. And at that point, it's too late. And if they can help spare one family from experiencing that again and witnessing that again, it's really important that folks step up and take that vaccine, not just for their health, but their family's health, and for the larger community.
Heidi, thanks for being with us tonight.
Oh, no problem. Thank you for having me.
Thanks. Okay, we're going to take a quick break and we'll be right back.